number of dollars. But do you think that we're going to sit around in rural America, or even in downtown urban America, in the poverty parts of the city, that we're going to let hospitals close down? And they raise the concern about access to health care. No, we aren't going to reduce benefits for seniors at all. But when you put our health care institutions and our delivery system in jeopardy, well, you're going to promise people health care they aren't going to get. You're going to put 14 or 18 million people under this bill into Medicaid. Medicaid pays about, in my state, I think about 60-some%. Medicare pays 80% of costs. Doctors don't take Medicaid. So you're going to promise 14 to 18 million people in Medicaid that they're going to be covered. But if you don't have doctors to service them, isn't that a little bit intellectually dishonest to promise something that you can't deliver on? And so there are these things in this bill, Medicare, Medicaid cuts, that I don't see any future Congress having any more guts than we do to close a rural hospital. So I think that you got to take into consideration. You've got to take into consideration the consequences of the acts or the unproven promises of cuts that aren't going to materialize. That's just the way I see it. And working in those 31 meetings, hundreds of hours of meetings with Senator Baucus, I learned a lot about health care. Now, we didn't get a bill out of that bipartisan effort, but I'm sure glad I spent all that time there, because I learned a heck of a lot about our health care system that I wouldn't have otherwise known.
Thank you, Chuck. I'm going to go to Kent next. I just want to make one point. If the notion is that we can't make some hard decisions about how entitlements work because it's just not realistic, nobody's going to have the guts to do it, then we're in big trouble. Because that means that the federal budget and state budgets and then business budgets and family budgets are all going to be gobbled up by this thing. So I hope that in fact we've got the courage to make some of these changes. Now, when I say that Medicare Advantage is not a useful way for us to spend tax dollars to provide health care to seniors, at least the way it's currently structured, as I said, that's not a Democratic idea. I mean, there are a whole bunch of Republican commentators and some of the folks who've sat around this table before who suggested that that's probably right. You can make an argument that whatever savings we get out of Medicare Advantage should not go to filling the donut hole, for example. That's a legitimate argument. You can make an argument that it should go just to deficit reduction. Those are all legitimate arguments, but my point is that the savings that are obtained here are from a program in which insurance companies are making a lot of money, but seniors who are in these kinds of programs are not better off. And the 80% of the people who are in these programs are paying an extra $90 a year to subsidize the folks who are in them. And that just doesn't seem like a good deal for them or for the taxpayer. Ken Conrad.
Will you give me 30 seconds, please?
Sure.
Yeah. I think we've already had it laid out here in 4 or 5 different ways how a heck of a lot of money can be saved. And I think that those things that we can agree on, we ought to proceed on. But I think that it's legitimate to take into consideration that if you're going to have program cuts that CBO says out there in the second decade could be 15 to 20% a year, that you got to have a system left to serve the people that we're promising health insurance to.
But what I'm saying,
and that's
Chuck,
the point I'm making.
I think it's a legitimate point. What I'm saying is that on Medicare Advantage, that does not have to do with the concerns that you've got about hospitals or doctors getting properly reimbursed. This is a program that's going to insurance companies. But I want to make sure that Kent gets in here, because Kent knows something about the budget as the chairman of the Budget Committee. Kent?
Well, thank you, Mr. President. Thank you for allowing us to come and visit about what really is the 800-pound gorilla facing the federal budget, and that is the health care accounts of the United States: Medicare, Medicaid, and the rest. What we all know that is true is the biggest unfunded liability of the United States is Medicare. What we all know is true is the trustees have told us Medicare is going to go broke in 8 years. So the idea that we don't have to do anything about Medicare is utterly disconnected from reality. The idea that we don't have to find savings in Medicare is an admission that we are headed for a fiscal cliff that we're going to go right over. And if we really want to endanger the benefits to people who are getting Medicare, the best way to do that is to do nothing. Because if we do nothing, we will guarantee that Medicare goes broke. So, together, we can either do this together or we can have this imposed on us. I very much hope we do it together. Senator Coburn, and I'm sorry, did he leave? I'm sorry that he's not here, because he said something that I thought was one of the most important comments made here today, and something that I think has gotten way too little attention. And that's the question of those who are chronically ill. As we analyzed Medicare, we found a startling statistic. 5% of Medicare beneficiaries, 5%, use half of all the money. I think Paul knows this well. 5% use 50% of the money. Who are they? They're the chronically ill. People who have multiple serious conditions. And I think Dr. Coburn was really referencing that when he talked about the need to better coordinate their care, because we are wasting massive amounts of money and getting worse health care outcomes than we could if we better coordinated their care. What do we mean by that? A study was done with 20,000 patients. They put a care coordinator on each one of them. These are chronically ill patients. And what they found was, by coordinating their care, and the first thing they did, by the way, is go into their kitchen tables, sit down, get out all their prescription drugs. On average, they found they were taking 16. They found that by looking at them, they could eliminate 8. The result was hundreds of thousands of dollars of savings per patient, better health care outcomes. You know, I did this with my own father-in-law in his final illness. Went to his kitchen table, didn't know it was his final illness, got out all his prescription drugs. Sure enough, he was taking 16. I get on the phone to the doctor. I go down the list. Dr. Coburn, you were out of the room. I referenced you because you said something that really triggered a thought in my mind that I think is important. Went down the list of what my father-in-law was taking, 16 prescription drugs. I get in the line to the doctor, and he says, well, Kent, I get down to about the third one. He shouldn't be taking that. He shouldn't have been taking that the last 5 years. I get a little further down the list, 2 drugs. He says, well, Kent, he shouldn't be taking those 2 drugs. They work against each other. I said, Doc, how does this happen? He said, Kent, it's very simple. He's got a heart condition. He's got a serious lung condition. He's got orthopedic issues. He's got doctors for each one of those. He's getting prescription drugs mail order. He's getting them at the hospital pharmacy. He's getting them down at the beach. He's sick and confused. His wife's sick and confused. We've got chaos. And my conclusion, after all of these hundreds of hours of hearings and meetings that Senator Grassley and Senator Baucus were part of and Senator Enzi, was that indeed we do. We have a system that is characterized, especially for those people, by chaos. We can do better. And we really don't have a choice, because we've got a debt now, a gross debt, 100% of our GDP, headed for 400%, that nobody believes is sustainable. So I I just pray that we find a way to come together and deal with these things seriously. Because if we don't, we will rue the day.
President, it's a little bit, if I might.
I want to make sure that we're balancing off time between Democrats and Republicans here. So,
Mr. President.
Well, I'm sorry.
And House and Senate as well. John, go ahead.
Mr. President, I'm going to say thank you for having us here. I think it's been